From Trump, let's turn to his biggest nemesis, the Wuhan virus. It's mutated so many times since 2020, and each time there is renewed interest. We hear more predictions and precautions. Tonight we're focusing on one of them, booster shots. Should you keep taking booster shots or not? The White House certainly thinks so. President Joe Biden is expected to release a statement soon. He will ask Americans to get booster shots. Well, what number are we on? Depends on your age and health condition. Biden, for example, has got 5 shots. Chances are he will get his 6th one before this winter. But why is the US suddenly talking about boosters again? Because of a new variant. It's called Pyrola. The strain has been detected in Israel, Denmark, the US and the UK. The World Health Organization is monitoring it. Based on their findings, they will designate the variant, whether it's a variant of interest or a variant of concern. But right now, it's too early to say. Doctors believe it has a significant number of mutations. Theoretically, that could help the variant evade vaccines. But Pyrola or not, cases are rising. The US reported 10,000 hospital admissions in the first week of August. That was 14% more than the week before. Pharma companies are confident that their shots are updated. Moderna released some data last week. They said their booster can defend against Eris and Fornax variants. Eris and Fornax, again, these are strains of the Wuhan virus. Eris has led to an increase in hospitalizations in the UK and Europe. But are boosters the answer to all of this? Let's look at a couple of factors. Number one, more than 5.6 billion people have received the Wuhan virus vaccine. That's around 72% of the world population. So much of the world is immunized. Factor number two, the mortality rate. Despite occasional spikes in cases, the deaths have not increased. India, for example, reported just 1 death in the last 24 hours. My point is simple. This is not 2020. We do need vaccines, but our strategy needs to change. The World Health Organization released some guidelines in March this year. They divided people into 3 groups: high priority, medium priority, and low priority. The high priority group includes older adults and people with comorbidities. These people need a 4th shot. They need it 6 or 12 months after the 3rd one. And don't mistake this for annual boosters. The WHO specifically warned against it. Listen to this. The additional booster recommendation should not be seen as for continued annual COVID-19 vaccine boosters. The aim is to serve countries planning for the near to mid-term. Now to the medium priority groups. These are people below 50 without comorbidities. The World Health Organization suggested 3 shots for them. So the primary series plus 1 booster. And finally, the low priority group, children aged 6 months to 17 years. For this group, the WHO has left the decision to governments. They said 3 shots are fine, but take a call based on your health situation. Like how much are you spending on it? Is it affecting other vaccination programs like measles or polio? Basically, don't make it mandatory. So the WHO guidelines cover up to 4 shots. But some countries are talking about triple boosters. How is that? Well, one reason is that they can afford it. The second reason is that the scientific community is divided. The US is talking about making Wuhan virus shots annual, like your flu vaccine. But some within the US FDA are not convinced. They say the flu is seasonal, but the Wuhan virus may or may not be. So the need for annual shots has to be proven. It has not been proven yet. We need a solid reason to keep taking shots, and that reason cannot be why not. Because pharma companies will keep investing in vaccines, they will keep updating them. Just look at what happened last week. Health companies dragged the entire US market down, but 3 firms bucked the trend. Pfizer shares were up 3%. Why? Because their booster showed some good progress. Moderna and Novavax also did well. Again, why? Because US hospital admissions hit 10,000. Do you see the problem here? We can't let pharma companies dictate the need for boosters. We have doctors for that. We have governments for that. There are vulnerable, aged people who genuinely need boosters. These people should keep taking them. The rest should follow scientific advice. Look at the opportunity cost. Look at the public health impact. Then you can decide on boosters. If your doctors tell you, don't think twice. Get yourself another shot. Otherwise, keep yourself informed. The WHO and other agencies have released enough information on jabs. Go to their website, read and understand.